Hello and welcome to our live event today. It is me, Caroline. I'm glad to be back with some other topics and some more experts. And of course, tonight, again, we are here to discuss another very interesting topic. And with us tonight is Mike Berkley. Hi, Mike. How are you feeling? And I just want to mention that Mike is connecting from New York City. So hello to you. Hello to New York City. Good day as well. How are you feeling tonight?
I'm very well. Thank you so much. I'm so thrilled to be here, and I'm very excited about doing this webinar together.
Well, I am very happy to have you with us on board, and I'm really looking forward to our event for sure. And as always, let me just remind everyone that we are gathering here every single day from the 1st of April to support you. We know that you probably are still not able to go ahead with your treatment, so we definitely want to make sure that you will be able to ask your questions, get some answers, get ready for the treatments, and we know that they will start very, very soon. So fingers crossed, all will be going into the right direction. And of course, as always, let me thank to our ambassadors and partners. You can see all of them right here. I always want to thank them for their constant support. All those events have been brought to you thanks to them as well. And as I have mentioned, we have another topic today. It is how acupuncture and herbal medicine can help improve pregnancy outcomes. So again, Mike will start with his introduction, then we will go for the most common questions, and after that, it will be time for your questions. So, as always, remember to type those questions in the chat section so that Mike can help you out. So, go ahead and do it. You can do it now or later on, of course. And let me just remind everyone that Mike is actually the founder and director of the Berkley Center for Reproductive Wellness. And as I mentioned, I am very, very happy to have you on board with us, Mike. And well, are you ready to begin?
I am. Thank you so much.
Excellent. Happy to hear that.
Okay, so I guess I'll say good evening to everybody, even though it's afternoon here in New York. I want to thank all of you for attending. I'm very grateful for the opportunity to be able to engage in dialogue with you and perhaps share some interesting information. So, as Caroline indicated, my name is Mike Berkley. I am a licensed and board certified acupuncturist, and I'm board certified in herbal medicine. And I've been treating fertility cases for 23 years here in New York City. And I'm ready to get this show on the road and give you a little information, and then I'll be happy to answer your questions. So, thank you all for attending as well.
Excellent. Thank you so much for your introduction. And well, we can start with the most common questions then, right, Mike?
Absolutely.
Perfect. Okay, so the first question is, so what disorders which affect fertility is acupuncture and herbal medicine effective at treating?
Okay, so the first thing I'm going to talk about is what acupuncture and herbal medicine are not good for. So they are not good for issues that concern anatomical defects. So, for example, if a patient has endometriosis and has scarring of the fallopian tubes, this is definitely a case for in vitro fertilization. Acupuncture and herbal medicine cannot unscar or unblock tubes. However, even in the case of endometriosis with bilateral tubal adhesions, scarring, or blockage, acupuncture and herbal medicine can still be used, but it must be used in conjunction with in vitro fertilization. And of course, why would acupuncture and herbal medicine be used even in this patient with endometriosis with tubal damage? Because this patient may, in addition to having endometriosis, be experiencing uh, either chronic failures with IVF treatment transfers or chronic miscarriages due to the fact that the egg quality is bad. So even though there's tubal damage, we can still work with this patient to try and improve the egg quality or the lining quality, or even with the husband if there's an issue with the sperm quality. So basically, uh, any type or many types or most types of fertility challenges can be treated with acupuncture and herbal medicine. So as I've described, we can treat the endometriosis patient, but not to remove the endometriosis. That must be done with laparoscopic intervention. We can certainly treat polycystic ovarian syndrome patients. We can treat patients whose diagnosis is nothing more than advanced maternal age, because women that are above 35 years old and older have fewer eggs than women that are 34 years old and younger. And remember, acupuncture and herbal medicine cannot give you more eggs, but usually when a woman has a low ovarian reserve, there is always, or typically, the addition of a compromised egg quality. So even in this patient with low ovarian reserve, if we can get her one good egg, and the sperm is good and the lining is good and the uterus is clear, she potentially has a great upside to improving her egg quality, even if she's 42 years old. Um, uh, so really, many types of fertility cases can be treated with acupuncture and herbs. I'm a firm believer that in 99.9% of cases, that the best case scenario for any patient that's experiencing fertility challenges is to be seen by a reproductive endocrinologist and to utilize acupuncture and herbal medicine. It's almost like 1 + 1 = 3, because the acupuncture and the herbs combined with reproductive medicine will actually be more effective than using one of those modalities alone. So I think I'm done with that question. Forgive me for being long-winded.
Excellent. Thank you so much, actually, for all the details. This is definitely interesting, and I don't mind details, such details. So go ahead and explore the questions as ever as you wish, of course. Okay.
Thank you. Thank
And
you.
well, let's have a look at the next one. So, can acupuncture and herbal medicine treat men?
So yeah, this is a very good question. So depending upon what literature anyone reads, male factor fertility issues account for between 35 and 50% of infertility cases. So many times you have, you know, cases where there's both parties are involved. So you have the female with polycystic ovarian syndrome, and you have the man with low sperm count, or some kind of combination like this. So again, it depends on what the situation is with the men. But I'll first tell you what we can do, and then I'll tell you what we can't do. So men that have low sperm count, poor morphology, poor motility, uh, and something else called sperm DNA fragmentation often can benefit from acupuncture and herbs. Acupuncture and herbal medicine very frequently can positively affect men by increasing sperm count, increasing morphology, increasing motility, and decreasing sperm DNA fragmentation. Now, let's talk about physical abnormalities or genetic abnormalities. So there's something called microdeletion of the Y chromosome, which is where men aren't producing sperm at all. This is a genetic dysfunction. Acupuncture and herbs, this is a donor sperm case. Acupuncture and herbs can do nothing for the patient. If a man has a severe varicocele, that means a varicocele that requires surgery, acupuncture and herbal medicine probably won't be efficacious in helping this patient. If a man has a minor varicocele, acupuncture and herbs sometimes can help this patient. If a man has a physical and anatomical defect, congenital bilateral absence of the vas deferens means that sperm cannot come out in the ejaculate. acupuncture and herbal medicine cannot treat that. So basically, if it's a count, morphology, motility, a volume issue, or sperm DNA fragmentation issue, acupuncture herbs can be and often are very effective.
Perfect. Thank you so much once again for
Thank
providing
you.
all those details on that as well. As you can see, there are questions coming up, but of course, we do have some of those right here as well. I can only hope to get pregnant with an IVF as both tubes are scarred. Are acupuncture and herbal appropriate for a case such as mine?
So another great question. I touched upon this a little bit in my first response, my first answer, but it's worth going into it a little bit more. So it really depends on the case. If you have scarred tubes, it's either because you had pelvic inflammatory disease, perhaps chlamydia, or perhaps endometriosis. So assuming that the pelvic inflammatory disease has been treated with antibiotics, but you still have scarred tubes and you must do an IVF. Well, if you're 24 years old and you have this issue, there's a presumption, at least on my part, until I know differently, that the egg quality should be very good. And therefore, you should do an in vitro fertilization and you'll probably get pregnant on your own. However, as I say, if the tubes are scarred or blocked because of endometriosis, this is a case for acupuncture and herbs, again, not to treat the endometriosis, but to help the patient get pregnant, because even after a laparoscopy, the patient still has endometriosis. Now, if there are any doctors listening in, they may raise their eyebrows or raise their hands like that, but I'm correct in what I'm stating, and I'll tell you why. Because some endometriotic adhesions, which is to say endometriosis tissue, that is outside of the uterus, but in the pelvis or in other areas of the body, look like normal tissue. So when a laparoscopic surgeon removes or excises endometriosis from the body, inevitably the surgeon will leave some endometriosis behind. Now, you can have endometriosis and not get pregnant even if your tubes are good. Why is that? The tubes are fine, everything is fine, but there's some endometriosis in there because endometriosis is an inflammatory disease. And even though endometriosis is a disease that takes place outside of the uterus, these inflammatory proteins called cytokines, these cytokines find their way inside of the uterus and elevate the temperature of the uterus, and therefore there is a hostile environment in the uterus in patients with endometriosis. And so you can utilize acupuncture and herbal medicine to try to reduce or significantly reduce or eliminate the inflammatory milieu, the inflammatory environment in the uterus. And this in and of itself will help to improve and increase the pregnancy outcome. And so, yes, even if your tubes are scarred or blocked, if you and have any history of infertility after IVF, yes, I would say that acupuncture and herbs could be useful for you.
All right. Again, thank you so much for answering that
Thank you.
question. And the question that we have next is, what constitutes a qualified acupuncturist herbalist?
So that's a very good question. I would say the same thing that constitutes a qualified acupuncturist slash herbalist is the same thing that constitutes a reproductive endocrinologist, meaning that the acupuncturist slash herbalist has gone through school, has sat and passed the state boards, has maintained their board certification in acupuncture and herbal medicine. And certainly, I would say that this is a couple of important things here. Many acupuncturists treat many things. So the typical acupuncturist will treat your back pain and your foot pain and your elbow pain and your headaches and your infertility case. I would never go to that acupuncturist unless that's the only option that you have. After all, you wouldn't go to a podiatrist, a foot doctor, to help you get pregnant. You wouldn't go to a neurologist to help you get pregnant. So why would you go to an acupuncturist who treats many things to help you get pregnant? You must go to an acupuncturist that specifically is involved in the care and treatment of individuals or couples faced with fertility challenges. So I think in addition to getting board certified and maintaining that certification in good standing, I think devotion to the pathology or the challenge of infertility and experience. So, for example, if you're going to have a choice between somebody who's been specializing in infertility, an acupuncturist herbalist who's been in practice for 1 year, and you have an option to see somebody who's been in practice for 5 years, I think that you should go to the practitioner who's been in practice for 5 years. So I think that's my response to that.
Excellent. Thank you again for explaining that. And now the last question when it comes to those most common ones. Are there any harmful effects on potential side effects from acupuncture and herbs?
So I was going to give a one-word answer, and my answer was going to be no, and that was going to be my entire answer, but I'm going to qualify that. There are no side effects from acupuncture outside of the fact that bruising can occur because one is sticking needles in the body, and so blood vessels can be broken, capillaries can be broken and cause a bruise. My response to that is, so what? Who cares? When you're injecting gonadotropins to do IVF, you get bruised too. So what? Who cares? It's only a bruise. The bruise will go away. Beyond that, there are no harmful side effects to acupuncture. Regarding herbal medicine, that's a whole different topic. Herbs are internal medicine. You drink them. They have various effects on the body. And I would only say this. You must only get herbs or be prescribed herbs by a board certified herbalist. This means somebody has gone to school for 2 years or 3 years or 4 years or whatever the program they're in to study herbs, and then they have to sit for a board examination to pass the board examination to be a board certified herbalist. Herbs can be dangerous. You have to think of herbal medicine the same thing as Western medicine. You wouldn't take Western medicine from your next door neighbor. You would go to your physician and get prescribed Western medicine because the physician knows the dose to give you. The physician knows that you shouldn't take this medicine because you have a heart condition, or you shouldn't take that medicine because you have hypotension. So there's various reasons not to give patients herbs, and the practitioner must be very astute and qualified and knowledgeable to make sure to give the patient the right herbs. Under the care of a board certified herbalist, it is my contention that you're totally safe. I wouldn't just go into a store and buy herbs, and I certainly wouldn't take herbs from somebody who's not board certified. You won't get killed with herbs, but I mean, you can have severe constipation, severe diarrhea, severe nausea. This is if somebody doesn't know what they're doing when they're prescribing herbs. So that's my response to that.
All right. Again, thank you so much for answering all those questions. And
My
of course,
pleasure,
right
of
now,
course.
as you can see, there are lots of questions ready from our patients. So, Mike, are you ready for them?
Yes, I'm happy to answer them.
Okay, excellent. So let's start with the very first one, and here it is. So first of all, of course, you are in New York City, but perhaps do you know any good reproductive endocrinologists, and acupuncturists in London?
So I do not. However, I know of, I don't know this person personally, but I know of a fairly famous acupuncturist in London who specializes in reproductive challenges, and she is very tied in to the good and respected reproductive endocrinologists in London. So I'll give you her name. you can Google her, and then you can connect with her, and she can lead you to the reproductive doctor. Her name is Zita West, Zita West, West. So just Google her in London, and she'll help you.
Excellent. Thank you so much for that advice as well as your help. I
Of
hope that will
course.
help as well to the patient. And let's have a look at the next question. So, how far in advance before IVF treatment should you start acupuncture, and how often?
So this is a terrific question. I got an email today from a woman. She's not my patient, but she just had a question for me. And she said, I've done two IVFs, and I had acupuncture right before the transfer, and both IVFs failed. Uh, so look, what you don't want to do is just do acupuncture pre-transfer or pre and post embryo transfer. Acupuncture is a process-oriented modality. How many of you that are listening in go to the gym? Well, probably if any of you go to the gym, I would put to you for your consideration that you don't go to the gym once a week. You probably go to the gym 2 times a week to 5 times a week, somewhere in there. It could be 2 times, it could be 3 times. More is better when you go to the gym. What if, God forbid, you're in a car accident and you bust up your shoulder and you get a surgery on your shoulder and you can't move your shoulder? You have to go to physical therapy. You're not going to go to physical therapy once a week. Of that, I can assure you. You're going to go to physical therapy 5 times a week, and then 4 times a week, and then 3 times a week for several months to get your shoulder to have a full range of motion and a reduction in pain. More is better. Acupuncture is a process-oriented modality. Under the care of myself, for example, my job is to improve the egg quality or the lining quality or the sperm quality, and that takes time. So the best case scenario is to be treated 3 months in advance of a retrieval. It doesn't often work that way. A patient will call me and say, listen, I'm doing a transfer next week and I want to start acupuncture. So my response to the patient is, that's fine, don't worry. Come in tomorrow and we'll start. And you're going to have your transfer next week. I'm going to treat you today, twice this week, pre and post embryo transfer, and then I'm going to treat you after the transfer. If you're pregnant after the transfer, wonderful. I'm going to treat you twice a week for 13 weeks to help prevent miscarriage, because 90% of miscarriages occur within the first 12 weeks. If, God forbid, the cycle fails, okay, that's awful. But remember, we've already started the acupuncture, even way before, like a week before your transfer. So we've already started to stimulate blood flow to the ovaries to help improve the egg quality and the lining quality in the uterus. Now your cycle has failed. We're going to continue to treat you twice a week until the next transfer. Then you'll get pregnant, possibly, hopefully, God willing. Then I treat you twice a week for 13 weeks. Then I say, goodbye, good luck, send me a photograph of the baby, or better yet, bring the kid in so I can give him or her a kiss. So I hope that I was able to give you some answer in a convoluted way.
Excellent. Thank you so much for your question, indeed, as your help with it, Mike. That's definitely useful. Okay, next question is, so what herbs do you suggest?
So this is a question that's unanswerable, but I will explain why it's unanswerable. Uh, just go ahead and email a reproductive endocrinologist who you've never seen and never met and say, dear doctor, hi, my name is Nancy Jones, and I want to know what medicine, what protocol do you suggest? Well, the reproductive endocrinologist is going to say, Nancy, I can't tell you that. You've got to come in. We've got to do an ultrasound. We've got to test your blood. We've got to do an intake, an evaluation, an examination. And then we can determine what the best protocol is. So in order to prescribe an herbal medicine formula, a full intake and evaluation has to be done. We have to find out what we're treating. How old is the patient? What's her weight? What's her health? Has she had a hysterosalpingogram to determine if her tubes are good? Do we know if the cervix is open enough? Does she have polycystic ovarian syndrome or endometriosis? Or perhaps she has a septate uterus that needs a surgery. It's impossible to say to suggest any herbs without doing an intake and evaluation first.
All right, excellent. Of course, thank you so much for explaining the
My
reasons as
pleasure.
well for that. Okay, next question is also ready. Is it possible to treat a 40-year-old woman with premature ovarian reserve decline?
Uh, 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 this is a tough question. So, premature ovarian reserve decline. I'm going to eliminate the word decline. And I'm going to say this. Forget the age. If your FSH is over 40, and you haven't had a period in 3 months in a row, unfortunately, in my humble opinion, this is a case for donor egg and not a case for acupuncture and herbal medicine. Now, if you're 40 years old or over 40 and you have ovarian decline, but you still have a regular menstrual cycle, what that simply means is that you have low ovarian reserve, but you still have a regular period. So that does mean, in fact, that you have eggs that are probably qualitatively not good. And so I would take a journey with that patient. But as I said, if the FSH is over 40 and you've not had a period for 3 months, I'm sorry to say that it's a donor egg case. I really shouldn't say I'm sorry to say, because doing donor egg is not a death sentence. In fact, it's a life sentence. You're going to have a baby with donor egg, so I shouldn't say it in a negative term. But acupuncture and herbs are not appropriate in that case.
Okay, understood, of course. Thank you again for that.
Of
Okay.
course.
Okay, just regarding the person you have mentioned, it was Zita West, right? Just to
That's
confirm.
correct. Yes,
Okay, excellent. Thank you for confirming that.
sure. Zita West is an acupuncturist.
Yes.
So she's not a reproductive endocrinologist, but she's an acupuncturist like myself who specializes in treating fertility issues. And she has connections, relationships with many reproductive endocrinologists in London. So if you contact Zita West, she can connect you with a good reproductive endocrinologist.
Yep, perfect. Thank you for clarification.
Sure.
And now let's go to the next question. So, is there a specific type of acupuncture you would recommend?
So this is another interesting question. My answer is no, and I'll qualify that a little bit. So original acupuncture comes out of China, but shortly after that, it moved to Japan, and then shortly after that, it went to Korea, and then the first European country to ever have acupuncture was England. They've had acupuncture in England for 400 years. In the United States, we've had acupuncture here only since 1975. So whether you find a Korean acupuncturist or a Japanese acupuncturist, let me restate. Whether you find an acupuncturist that does Japanese style or Korean style or Chinese style acupuncture, none of it matters, because they are all legitimate and effective and of value, as long as the practitioner is qualified and knows what they're doing.
All right. Thank you so much once again for that. And
Thank you.
We do have another question, a bit longer this time, so let's have a look. My potential egg donor has been found to have a corpus luteum, small yellowish cyst filled with fluid. Would she be a good candidate for acupuncture and herbal medicine? Would this contraindicative to her taking prenatal vitamins, organic flaxseed oil, vitamin D, folic acid, probiotics? Should her diet change to include or not include certain types of food?
So this is a difficult question as well. I'm not sure what this, this small yellow. I can't fully see the question because my picture is obscuring it. But I'm understanding that the corpus luteum has some yellow fluid in it. Um, the corpus luteum in Latin actually means yellow body. So the corpus luteum is supposed to be yellow. Um, so I'm not sure that the person that is asking the question, I'm not sure that this egg donor has pathology. That's the first thing I want to say. Um, so I'm not sure that there's pathology there. If there is pathology, uh, and this has happened only one time, and it's a young proven donor, I wouldn't be too concerned about it. However, yes, it is good for that patient. I suppose it's good for that patient. It won't hurt the patient to take prenatal vitamins. They are good for the surrogate, for the donor. Flaxseed oil is good. Definitely vitamin D is good. Folic acid will be in folic acid is part of the prenatal vitamins. Um, the doctor told me when I asked what is a corpus luteum. The doctor told me when I asked what is a corpus luteum.
This
Yeah.
is
So
Mhm.
again, so if she has some yellow fluid, it doesn't necessarily mean there's pathology. And if she's a proven donor, I wouldn't worry about it. But Angela, to answer your question, any of these nutraceuticals or vitamins, the things that you mentioned, that screen is off the board. But prenatal vitamins is good. I'm not sure about the probiotics. That's for a stomach issue, so I don't think it has much to do with fertility. But I hope I've answered you adequately.
And just a follow-up, just from other patients suggesting isn't a corpus luteum what is formed anyway after ovulation and retrieval?
Well, yeah. So after a woman ovulates, so first of all, what happens is the first thing the woman has is called the follicle. The follicle uh, houses the egg, and once the egg is extruded or comes out of the follicle under the influence of something called LH, which is in the brain, it's luteinizing hormone. This becomes the corpus luteum. The corpus luteum is manifest during the luteal phase, which is to say, let's just say a woman has a 28-day cycle, hypothetically. She ovulates on day 14. So then she has a corpus luteum, and that corpus luteum's job is to secrete a little bit of estrogen and a lot of progesterone to get the endometrial lining ready to receive an embryo, ready to have an embryo implant, and ready to facilitate pregnancy. So that's what the corpus luteum does. If pregnancy is not manifest by cycle day 21 or cycle day 22, the estrogen and the progesterone sinks. The corpus luteum now becomes something called the corpus albicans, which means the white body, and the woman menstruates.
All right. Thank you so much for explaining. As you can see, there is another, it was found straight after her period. So just a follow up, of course, from Angela.
Yeah,
Okay.
so Angela, I'm not 100% clear on the case. I understand your question completely. I think really what I'm saying is I don't have I don't think I can offer you any more. I would certainly speak to a reproductive endocrinologist, and if she had yeah, if she had a corpus luteum right after her period, uh, perhaps the corpus luteum hadn't become a corpus albicans yet. and now it is. And perhaps it was a little late in transferring from a corpus luteum to a corpus albicans. I would recommend speaking to the reproductive doctor.
Oh, of course.
Thank you, Angela.
Well, thank you so much for your question as well as your help with this as well. All right, next question is also ready. So, can you still do acupuncture once the embryo transfer has been done? So, during the 2 week wait?
So again, I want to tell everybody that's participating that these are fantastic, intelligent, well thought out, and really good questions. So congratulations and kudos to all of you. Um, yes, absolutely. Acupuncture should be done during the 2 week wait. This is what I explain to my patients. After the transfer, you must continue to get treated twice a week, and we're going to pretend, let me back up. We're going to treat you twice a week after the transfer to help prevent miscarriage. Now, that may sound odd, help prevent miscarriage. She just had the transfer. How do you even know she's pregnant? In fact, she can't even be pregnant, right? Because it takes 5 days for an implantation to occur, or 6 days, 5 to 6 days. But we must treat the patient and pretend that she's pregnant. Why pretend that she's pregnant? Because we're not going to know if she's pregnant until she has enough HCG that can be detected through the blood to determine that she's pregnant. But obviously, she's going to be pregnant before that HCG is elevated enough in the serum, in the blood, to be detected. So we have to act as if, using the acupuncture to stimulate blood flow to this developing embryo and even the developing placenta. Well, that comes from starting at week 5. But yes, we must continue to treat right after the transfer nonstop. There is one important thing to say, that there are certain contraindicated acupuncture points in a pregnant patient. So let's say that a patient had an IVF with a blastocyst, a day 5 embryo. So this may take 1 or 2 days to implant. So even if I saw this patient, she had, today is what, Monday? So if I saw she had a transfer of a 5-day embryo today, and the next time she came to visit me was Wednesday, 2 days from now, I would change my acupuncture protocol. I would make sure to use the acupuncture points that are meant to mitigate, to reduce the chances of miscarriage, but also to not use any contraindicated points that possibly can facilitate a miscarriage.
Excellent. Again, once again, thank you so much for that. And
Thank you.
well, there's a question. Just let me go to that. Sorry, lost it. No, here it is. In an IVF cycle, which are the ideal days to do acupuncture? Example, which days of stimulation, which days before, after embryo transfer, and during the 2 week wait?
In, in which, can you just read the first sentence again?
Yes, in an IVF cycle, which are the ideal days to do acupuncture?
Okay, I got it. Thank you
Yeah.
so much. So, okay, so again, you want to get acupuncture if you can 3 to 4 months before you even start using the injectables. But assuming that you're going to do a transfer next week and your best friend said that, listen, you should try acupuncture, or your doctor said that, you don't have 3 months, so start now. Certainly on the day of transfer, you should get acupuncture pre and post embryo transfer on the same day. So you have to be at the doctor for the transfer at 3 o'clock this afternoon. You must get acupuncture at 1:30 or 2 o'clock in the afternoon, and then go back to the acupuncturist at 5 o'clock this afternoon after your transfer, and then go home and rest. And then the question continues, for example, which days of stimulation and which days before and after, da 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 da. And so I've answered most of the question. And then during the 2 week period, the 2 week waiting period, which, as I mentioned previously, you should continue to get acupuncture. If you get a transfer today, Monday, come back, make them believe you're in New York City. You will see me today 2 times, pre and post embryo transfer. Then you will be back this Wednesday for treatment. and this Friday for treatment. And then next week you will come back twice for treatment. And I'm going to treat you as if you're pregnant until I find out that you're not. And when you're not, I'm going to continue to give you acupuncture. Then when you do the transfer, I'm going to treat pre and post, and you'll be pregnant. And then we're going to continue to treat you twice a week. Right after the transfer, right after we find out that you're pregnant, we're going to treat you twice a week for 13 weeks to help reduce the possibility of miscarriage.
All right, excellent. Thank you so much for this
Thank
again.
you.
And well, there are more questions coming up, and we will go to the question from Angela. Okay, it's regarding my surrogate. Okay, so my surrogate behaving acupuncture and herbal drinks. Anything she should not do either?
So if you're if so if the surrogate is if the surrogate is getting acupuncture and herbal medicine by a board certified acupuncturist and a board certified herbalist, that's totally fine. And perhaps she wants some help with her uterine lining. Um, I'm not exactly sure why the surrogate would need acupuncture and herbs. Let's just play with this idea. You have a 28-year-old surrogate. You're going to transfer this embryo into her, and she's perfectly healthy. She's 30, 28, 31. Her uterus is good. Everything is normal. Everything is fine. Why does she even need acupuncture and herbs? And if she does, then perhaps she's not the right surrogate, unless you're using a family member, which sometimes happens, right? Sometimes somebody will use their sister or something like that. So there's an emotional reason to do it. But the surrogate should only get acupuncture and herbs if the surrogate needs acupuncture and herbs. And if she needs acupuncture and herbs, then it's safe for her to take it, as I said, as long as she's under a board certified specialist's care.
Okay, excellent. Thank you for that clarification as well. Okay, and next question is, so how exactly does acupuncture reduce inflammation? Would it help if my Th1, Th2 cytokine ratio, TNF alpha is high?
So this question is definitely coming from a doctor. Thank you for your question, doctor. So for those of you who don't understand this question, Th1 is a T helper cell 1, which is an inflammatory. T helper cell 1 is a protein that produces inflammation, and Th2 is an anti-inflammatory protein, or an anti-inflammatory cytokine, and so this is very complicated stuff. So most people, including myself, think that inflammation is the root of all pathology, and of course pathology causes inflammation. However, inflammation in many cases is our friend, and in the normal typical uterine environment, it always starts out in a Th1 environment. In other words, there's always inflammation in the uterus, but you have to understand, lighting a match to light your cigarette is no problem, but setting your house on fire is a problem. But they're both flames, they're both fire. It's just the level of fire and how long is the fire going to last. If you light the match, it'll stay lit for a minute and go out. If you light your house on fire, it could be burning for 4 days. So you want to have Th1 present in the uterine cavity, because inflammation serves to degrade the uterine lining. I'll repeat that. It serves to degrade the uterine lining. You want degradation of the uterine lining, because degradation of the uterine lining helps facilitate an embryo implantation. After a certain point, perhaps once the embryo is implanting or has implanted, there is a transference of Th1 to Th2. So the uterus no longer is being affected, if you will, by an inflammatory environment. It's being affected by an anti-inflammatory environment, which is the correct environment for the ongoing health and development of the implanted embryo. Now, the next part of this question is the TNF alpha is high. It's a little bit out of my scope of knowledge when we talk about TH1, TH2, and TNF alpha. I'm not trying to understand the relationship between those two, but I will speak about TNF alpha anyway, within a different context. Women that have elevated, activated natural killer cells will have elevated, not elevated, will have inappropriate excretion of TNF alpha. And what TNF alpha is tumor necrosis factor. TNF alpha resides in the uterus. 70% of TNF alpha resides in the uterus. 30% of it is in the bloodstream. Nobody knows what it's doing in the bloodstream, but we certainly know what it's doing in the uterus. It's there to fight uterine cancer and ovarian cancer. But the only time TNF alpha or activated natural killer cells, which spray TNF alpha on the tumor cell, the only time that natural killer cells should be activated is if there's a tumor. So if you have activated natural killer cells that are manifesting and you don't have cancer, this is an autoimmune disorder. And these natural killer cells are spraying TNF alpha, not on a tumor cell, but on your embryo and killing them. And so the way to treat this is not with acupuncture and herbs, but with intralipid therapy, or IVIG, which is intravenous immunoglobulin therapy, which is quite expensive. Most doctors have shifted to intralipid therapy, which does the same thing. It will suppress the natural killer cells, and you'll go ahead and get pregnant and everything will be fine. So this is a rather advanced and complicated question. I hope, and so we never talked about acupuncture. How does acupuncture reduce the inflammation? So I would say if a person has activated natural killer cells, acupuncture and herbal medicine are not the right modality. Intralipid therapy is the right modality. And if you have a TH1 environment in the uterus that's ongoing, that is also probably not the best case for an acupuncturist and herbalist. We have to find out why there's a TH1 predominance in the uterus. Is it because this patient has endometriosis or endometritis or some other inflammatory disorder in the uterus? So this has to be parsed out by a reproductive endocrinologist. I think I'll end this my answer there.
Okay, thank you so much for your question as well as your help with this. And there's a thank you from the patient. Thanks, Doc. That was an excellent answer. Very helpful.
My pleasure. Thank you.
Excellent. Thank you. And well, let's have a look at the next question. So, can herbal medicine be taken alongside other supplements and IVF medications?
I just want to say I am so impressed with these questions. You know, it almost sounds like my best friend acupuncturist is asking me these questions. You know, these are just great questions. So here's the answer. The answer is absolutely 100% yes. Herbal medicine can be taken with supplements and IVF medications. However, I will go back to something old and then talk about something new. The old is make sure that your acupuncturist and herbalist is licensed and board certified, has at least 5 years experience in reproductive dysfunction, has devoted their practice to it, and knows what the heck they're doing. That's my first answer. That's kind of repeating what I said before. The new answer is, or in addition to that answer, most reproductive endocrinologists, 99% of them, will not want their patients taking herbs while you are taking what's called gonadotropins, reproductive medicine. And it's not because the reproductive endocrinologist is a bad guy or a bad gal, or they don't know any better, or this and that. They don't want you to be taking herbs because they don't know herbs. They know Western medicine, and they are making an assumption, justifiably so, based on their educational background, that the herbal medicine may either attenuate, may increase or decrease the effect of the reproductive medicine. So they want the reproductive medicine, the gonadotropins, to go into your body and not to be mitigated by other things. From my 23 years of experience, I've given many, many patients herbal medicine while they were on gonadotropins, and they've either gotten pregnant or they haven't, but I'm quite comfortable in saying that they haven't gotten pregnant because they were taking herbal medicine. Because I've given patients herbal medicine while they were on gonadotropins and they did get pregnant. So I don't think there's any downside to taking herbs while you're taking gonadotropins. I do believe in full transparency. Of course, one will do what one will do. But in my humble opinion, it's my belief that you should fill in your reproductive endocrinologist and tell him or her that you want to take herbs and, have the discussion. So everybody's working as a team.
All right, perfect. Thank you once again for great question and for your assistance with that. Next question is, so is acupuncture also recommended during pregnancy if IVF has been done to improve a positive live birth?
Yes, 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 100%. As I mentioned earlier, on every patient that I have, once they get pregnant, I treat them twice per week for 13 weeks, and then I let them go. The reason for that is 90% of miscarriages happen within the first 12 weeks. So I never treat past 13 weeks, with a rare exception. If I have a patient who has miscarried twice in the second trimester, I may treat her for the entire pregnancy, but I must confess, in all honesty, in my 23 years of practice, I've not had that case ever. But to get back to be more specific to you, yes, you should continue to get treated twice a week for 13 weeks after pregnancy is confirmed.
Excellent. Thank you so much again for that. And there's a follow-up question in regards to the previous one. So are the herbs you give taken as liquid, or are they pills, or in some other form?
Another great question. Another great question. So there are several methods of delivery of herbs. One is you can take pills. One is you can take granules, which just looks like a powder, and you take the powder with some spoon and you put a certain amount in the cup and you pour boiling water and you drink it. The other one is called a tincture, which is a fluid. It's a liquid with an eyedropper, and you take a certain amount out and you just put it in your mouth and drink it, or you put it under your tongue. I'm not familiar with how to take it because I never used them. And then the fourth way is raw herbs, actually herbs, real herbs. Now, the strongest type of herbs are the raw herbs, and the best type of herbs, in my opinion, are the raw herbs. Let's start from the top and look at pills. A pill comes in a bottle, and you're going to give this bottle to 25 patients, but the pills contain the same dosage and the same amount of herbs and the same type of herbs in the pill. So you're going to give these herbs to 25 patients or to 2,500 patients. There's no ability to differentiate, to change the herbal formula. The beauty of herbal medicine is that you can compose an herbal medicine that is specific and exactly created only for the individual patient in front of me or any other practitioner. So I don't enjoy nor respect the utilization of pills in the dissemination of herbal medicine. Powders, granules can be very good. The reason that I'm not in love with powders is because, again, talking about raw herbs, one of the things about raw herbs is that when the pharmacy cooks the herbs for you, my pharmacy cooks the herbs for you. Many patients have to cook their own herbs. The pharmacy that I work with cooks the herbs. So sometimes I want herbs to be prepared in a certain way. I want you to fry this herb with salt. I want you to fry this herb with honey. Or I want you to mix this herb with another herb, but the other herb gets thrown out and doesn't get put in the formula, because just using the other herb will change certain properties of this herb that I want to keep in the formula. So you can only do that with raw herbs. Again, a reason that I like to use raw herbs. And as far as the tinctures are also not necessarily a bad way to go. I think they're fairly efficacious. But again, those herbs cannot be processed. In Chinese, if you Google Pao Zhi, P-A-O, and the next word is Z as in zebra, H-I, Pao Zhi. Pao Zhi means the processing of herbs. Everybody listening can Google it. And you'll see that there's different ways to process herbs. The only way that you can do that, the highest level of refinement in herbal medicine, is raw herbs.
Excellent. Once again, thank you for providing all such details and the differences, of course, for that as well.
Thank you.
Okay, next question is also ready. And just a second, here's the question. So you kind of answer, but if anything, you can add to that how acupuncture
No,
can
this is
help
a new
before.
question. This is a different question, a totally unique question.
Okay,
This
excellent.
has not been asked before. So another very good question. So let's see how we're going to do this. Okay, I'll use my hands. So the vagina looks like this, but the vagina can open like this. And well, you may not know, but the uterus is exactly the same. The uterus looks like this or like this. It's completely flat. It does not look like this. It is not like an open little bowl below your tummy. It is flat. So if you can see my fingertips, in front of my fingertips is the vagina, and then north of the vagina is the cervix, which is right around here. And then in here is the uterus. So when somebody is getting an embryo transfer, how is that done? The reproductive endocrinologist puts a tube through the uterine cavity, through the uterus, through the cervix, here, into the uterus. Whenever the top of the uterus or the bottom of the uterus is touched by anything, it will go like this. That's called spasming. So I'm going to stop for a second and just tell you something else. There are a higher number of ectopic pregnancies in IVF patients than in the non-IVF population. Why is that? Because when that tube containing the embryo is put into the uterus and the uterus is spasming, it can cause retrograde flow of the embryo, meaning it can take the embryo and make it go backwards and sit and reside in the fallopian tube, and then you will have an ectopic pregnancy. So when you do acupuncture before transfer, you're stimulating a lot of blood flow to the embryo, to the uterine cavity to help nourish the uterus itself and get the uterus ready, additionally ready for the implantation. After that transfer is done, your uterus will be spasming. So you go back to the acupuncturist, they put needles into the uterus. Remember, the first treatment was to drive blood to the uterus to help receive the embryo, to help facilitate implantation. But after the transfer, the acupuncture is done to take the uterus going like this, if you can see this, and to make it go like this. And just to stop spasming, which will greatly reduce the possibility of an ectopic pregnancy and therefore greatly increase the percentage of an endometrial pregnancy, a uterine pregnancy.
Again, thank you so much for answering this
Great
question.
question. Thank you.
Excellent. And there are more coming up as well. And the next one is here. After my session is complete, sometimes the needle sites are achy and often itchy. Do you know why?
Maybe. So I'll talk about the itchy first. So the itchy is nothing to worry about. It's not uncommon. It's a histamine response. It's simply something that kind of acts up during almost, you could say it's almost an allergic reaction. I don't want to say you're having an allergic reaction to the acupuncture, but it's almost like it's brother or sister of allergy. The body kind of thinks something is weird that's going on, and it's sending these histamines to the site. It's completely irrelevant, completely meaningless. What it is it's annoying, but it has no negative connotation whatsoever. Now, as far as the sites being achy, in my opinion, they should not be achy. 90% of the time, needle insertion, or 99% of the time, needle insertion, the insertion should not be painful. Retrieving the needle should not be painful. And you should absolutely feel no pain after the needles. So there are some people that are needle sensitive. I happen to be needle sensitive. When somebody puts a needle in me, I hate it. I find it very painful. I know it's ironic, but I can't lie. It's true. And so you may be needle sensitive. So if you are needle sensitive, perhaps you are, ask your acupuncturist if he or she can use thinner needles. There's a type of needle, it's a Japanese needle. It's manufactured by Sarin, which is Seiren or Seirin. I'm not, I don't remember, but they're called Sarin needles. And they're extraordinarily thin, thinner than the typical needles. And you should not feel anything with them. No pain, certainly. You still may get the itching, but you won't have any discomfort.
Okay, excellent. Thank you so much once again for that. Okay,
Thank you.
next question is also ready. Is acupuncture during the IVF cycle just for relaxation? Does it actually help?
So that's a great question. So I never treat a patient for relaxation. I mean, if my patient's on the table and I say to her, "Are you feeling stressed and anxious, or are you feeling depressed?" I'll certainly treat her to try to make her calm and relax. But that is not why I wake up every morning. Hey, Stephanie, thanks for the question. That is not why I wake up every morning and run to my job. The acupuncture is meant, in my hands, certainly for three reasons only, which is to improve egg quality, lining quality, and sperm quality. Certainly, if you're on the table, yeah, I'll use needles to help you relax. But if I got a call from a patient who said, "Listen, I want to come in," I have had this call. Now, I've had this call several times. Listen, I want to come in to get acupuncture to relax. I'll never treat that patient. I'll be very nice to the patient on the phone, but I'll say, "Listen, it's just not what I do. I really appreciate your call. Thank you so much. There's a million acupuncturists out there. You can go to somebody else, or you can just go and get a massage. That's very relaxing as well, or meditate, or do whatever do your thing. That's not what I do, but I wish you the best. Thank you." So, acupuncture is a lot more than relaxation.
Okay, excellent. Again, thank you so much.
Thank
Okay,
you.
next question is right here as well. So, can acupuncture and herbs help with ovarian cysts?
That's an interesting and a good question. So, if I ask this person a question, can they answer me? Can they type an answer?
Sorry, yes?
I want to ask this patient something. Can I do
Yes.
that and have them? Okay. Do you have polycystic ovarian syndrome?
Let's wait and see. Okay, let's have a look. If we have no, the answer is no.
Okay. So, in that case, what I'll say is uh, many women get ovarian cysts. There are many different types of cysts, but certainly what's often encountered is something called an LUF, which stands for a luteinized unruptured follicle. So the woman is about to ovulate, this LH spike, the LH goes up, which is what's going to make this woman ovulate, and her follicle is trying to burst open to release the egg, but it doesn't, and it turns into a cyst. So if that's the kind of cyst that you're talking about, this is not uncommon. It is unfortunate because what happens is the IVF cycle is typically canceled until the cyst goes away. Usually the cyst will go away on its own within a month. Sometimes a doctor will give a patient birth control pills to help the cyst go away, or if it's a different kind of cyst, a dermoid cyst or an endometrioma, which is a cyst from endometriosis, then a surgery is required. Um, so if this is a luteinized unruptured follicle and it happens frequently, uh, I would give acupuncture and herbs a try. I haven't had this kind of case before, believe it or not, in 23 years. I've never had this kind of case, but I would say that it falls easily within the realm of acupuncture and herbal medicine treatment if, in fact, it's a luteinized unruptured follicle. It's that kind of cyst and not a dermoid cyst or an endometrioma or another type of cyst.
All right, excellent. Once again, thank you for
Thank you.
this.
Great
And
question. Thank you.
of course, there's thank you from the patient
Thank
as
you,
well.
God.
Okay, next question. So, do needles go in a specific location for infertility, or does it depend on the actual diagnosis of infertility? For example, equality and lowering FSH.
Hi, Della. Thank you for the question. So the needles go in specific locations for fertility. So do needles go in a specific location for infertility? So infertility doesn't really. What is infertility? What is infertility? Infertility means you can't get pregnant, right? Um, well, I can't become the next world champion middleweight boxer. Why not? Because I'm too old, and that's why. So uh, I would have to do certain. I'm trying to come up with an analogy here. The reason that I couldn't be the boxer is because I'm too old. So the question is, we're not treating infertility. Now I know that sounds odd. We're not treating infertility. We're treating why the infertility. What is making you infertile? Is it that you have polycystic ovarian syndrome with too much androgen in the follicles and you don't ovulate and you don't menstruate? Is that you have these pro-inflammatory cytokines in your uterus, and even in the absence, or you might have some endometriosis? Yes, then we can treat that. Is it because you have unexplained infertility, but you're anatomically within normal limits? Yes, we can treat that. So the needles are going to go in a patient in certain locations based on what the differential diagnosis of the acupuncturist is. So if you come in and you're 250 pounds and you're 25 years old with polycystic ovarian syndrome, you're going to be treated completely differently than if you're 120 pounds and you're 23 years old, or the same age, and she has polycystic ovarian syndrome. So it would be different acupuncture locations and different herbal medicine formulas for both patients.
All right, thank you so much, Mike. As you can see, there are like additional information. So no PCOS, no endometrium, normal menstruation, and
Yeah,
just
I'm gonna
yeah.
pass on this because I think I answered it before and I don't remember the previous question. But okay, so
It's
the
the follow
FSH
up.
is
Yeah,
10.
it's in regards to
Yeah,
this
so
one.
okay, I can respond to this. So this is very difficult to respond to because your FSH at 10.3, it's not so bad. But if your estradiol is above 65, then your FSH is not really 10.3. Your FSH is probably 12, 13, or 14, or 15 because an elevated estrogen level will suppress your FSH. So FSH is not the best number to look at. The better number to look at, which will determine your ovarian reserve, is AMH.
Of course. Okay. Thank you so much again for that. Okay, there are a few questions left. Okay, so we will be slowly finishing, but okay, sorry, one more thing. AMH 2.85.
So that AMH looks to me like a very good, positive, beautiful AMH. So it looks completely terrific and healthy and normal. And every patient would like to have that FSH. Now, there is one thing I want to say about that. I'm assuming, Della, that you're in Europe and I'm in the United States. And in Europe and in the United States, we use different units of measurement. So 2.85 may be elevated within the context of the unit of measurement that's used in the country in which you reside. But if you were in America, based on our unit, you're in California, so a 2.85 or 2.58 is, yeah, that's totally normal and fantastic and wonderful. That means you have a decent, very decent ovarian reserve.
All right. Excellent. Thank you so much again. And well, you can see next. Thank you for all of
My
your
pleasure.
advice.
Thank you, Del. I wish you the best.
Excellent. Thank you so much. Okay. Next question is ready. So, if you cannot do pre and post transfer on the same day, is that okay too?
So look, everything is okay. You know, I've had patients who have come in and they're like, oh my God, I was supposed to take the HCG shot last night, you know, the Overdrill shot, the shot that's going to make them, well, to get the egg ready for retrieval, or in an IUI case to make them ovulate. I forgot to take it. I was supposed to take it at 8 o'clock last night, but I took it at midnight. It's not the end of the world. So if you can't do acupuncture pre and post embryo treatment transfer, let me say this: there have been about 5 billion women in the history of mankind that never got acupuncture, and and they got pregnant. So acupuncture is not the be all and end all. And I think that acupuncture, and there's data and science that now kind of attests to the fact that doing acupuncture pre and post embryo transfer is very helpful. If you can't do it, you can't do it. It's not the end of the world. Do the best you can, and that's all that one can ask. And let's keep our fingers crossed.
Excellent. Again, thank you so much for that. Okay, next question is also ready. If as a man you have good stats, healthy sperm count, good motility, is it worthwhile having acupuncture? Still, our fertility is unexplained with both of us having healthy results.
So another great question. So let me explain something about sperm DNA fragmentation. Uh, the DNA in the sperm should look like this. And DNA fragmentation means this is what the DNA looks like in the sperm. There are many issues. It's a very big, deep topic, which I'm not going to go into, but I'm going to give you a very important piece of this. A man that has sperm DNA fragmentation above a certain amount, above 29%, that sperm cannot penetrate an egg. And so above 29%, there are very few pregnancies. And then doctors will say, well, it doesn't matter, we'll do ICSI, which is intracytoplasmic sperm injection, where they inject the sperm into the egg. Very often it doesn't work because you're injecting a bad sperm into an egg. But let me get back to this now. 90% of men with sperm DNA fragmentation, let me repeat, 90% of men with sperm DNA fragmentation are men that have poor sperm parameters. However, 10% 10% of men that have perfect sperm also have sperm DNA fragmentation. So if you guys are in, you're not, let me put it this way, you should send the man should go and get a sperm DNA fragmentation assay. Sperm DNA fragmentation assay. And I'll give you the stats right now very fast. If there's DNA fragmentation of 0 to 15%, there's a good to fair fertility outcome. 15 to 29%, it's I think, fair to poor outcome. And above 29%, there are very few documented pregnancies. So you'll know this, so when you get the paperwork back, you'll know how to interpret it. But I'm sure the doctor will interpret it for you. But I recommend the sperm DNA fragmentation assay. I also recommend something else to Sumi. You must get a test called urea plasma test. UREAPLASMA, urea plasma. This is an undetectable sexually transmitted infection. It doesn't mean that you cheated on him or he cheated on you. It simply means that if either one of you were sexually active before you met each other, you could have gotten this bacterial infection. It's completely asymptomatic, but it attacks sperm and embryos, and it can be treated. The man never gets tested. The woman only gets tested. If she has it, the man automatically automatically has it, and you're both put on antibiotics for 10 days and then rechecked. This is a very often overlooked pathology that must be tested. I recommend that to you. I recommend the sperm DNA fragmentation. Excuse me 1 second. Alexa, stop. I apologize. Ureaplasma, sperm DNA fragmentation. You should also get a fluid ultrasound, which is where they put saline solution in the uterus and look in the uterus to make sure you don't have polyps. Polyps are benign, they're not cancerous, but they will make it so you cannot get pregnant. You should have that done. And obviously, you must have a hysterosalpingogram, which I'm assuming you've had, to make sure that your tubes are good.
Fantastic. Fantastic. Thank you so much once again for your
Thank you. My
thorough
pleasure.
explanation to that one. Okay. Next question is, so do you work with black cohosh and dong quai? If yes, what are they used for?
Yeah, no, the answer is no, I don't. Chinese, so Andrea, thanks for the question. Chinese herbs don't work like this. So I know that people go into the drugstore or the health food store and they buy these things, they take Vitex and Dongwei and all this. It doesn't work like that. Let me tell you what happens when you're taking Dongwei. I'm going to make an analogy for a chicken soup. Okay? So I have this big pot, I put it on the stove and I fill it with with chicken stock, and I put in the chicken and I turn on the soup and I cook it for 3 hours, and there's my chicken soup. It's not going to be very good. Why not? Because there's no salt and pepper in the soup. There's no carrots or potatoes or celery in the soup. And there's nothing else in the soup that you might want to put in the soup, because the soup needs ingredients. It needs ingredients to make it delicious, to make it more palatable. So it is the same with herbs. You can't take an herb and have an effect. Herbs are only given, at least in the context of Chinese herbs, they're given in formulas. So a formula is 2 or more herbs. So that's really the way it works. I will meet a patient, do my evaluation, and sit down for an hour and literally think about what I want to give the patient, write down the herbs, and review it 5 times. Take out this herb, add this herb, take out this herb. Let's cook this herb with this herb. Let's cook this herb with vinegar. And oh, I don't want to use 15 grams. I've changed my mind. Let's use 12 grams instead of 15 grams. This is how you really do herbs. So just taking Dongwei or black cohosh is an utter waste of time.
All right. Thank you once more for your clarification to that, of course, as well. There are like 3 questions left. So
I'm happy to take them if you guys have the time.
yes, of course, we can still
You're
go ahead
welcome,
with
Sumi.
those, definitely. And the next question, so can acupuncture help cure asthenoteratospermia?
So asthenoteratospermia basically means poor motility and poor morphology. Motility means the ability of the sperm to swim in a straight direction, and the morphology means the shape of the sperm. So if it is not as a result of undescended testes when the man was a child, if it is not as a result of a chronic exposure to radiation or certain chemicals or certain drug medications that the man had to take, if it is not as a result of some physical, anatomical, structural defect within the testicles, yes, acupuncture and herbal medicine would be very effective for asthenoteratospermia.
Again, thank you so much for that. And
Thank you.
next
Great
question
question.
is, can acupuncture help with vaginismus?
It's totally out of my scope of knowledge. I'm terribly sorry. I'd rather give you an answer of I don't know than to answer it where I don't know. So the answer is I don't know. I'm so sorry.
Of course, understood. Thank you so much. Okay. And it looks like this is our last question for today. But I just want to mention that if you would like to get some more answers and would like to get some more details, remember that you can also use the link I have just sent to you, and that way you will be able to ask your questions to, and Mike, of course, I'm sure will be happy to provide you with more details. Right, Mike?
It would be my pleasure to answer anybody's questions that you can generate through my answers, my IVF answers. Is it okay if I give my website?
Yes, of course. Go ahead.
Okay, thank you so much. My website is berkleycenter.com. It's spelled B as in boy, ERKLEY, center, berkleycenter.com. Have a look. There's a lot of good information on there for you.
Excellent. Thank you so much again for that. And well, let's go to the question. So, can acupuncture help increase AMH?
Absolutely not. AMH is a representation of ovarian reserve. Acupuncture and herbal medicine can in no way, shape, or form give a woman more eggs. She's born with all the eggs she's ever going to have. She loses at least 1,001 eggs every month. 1,000 become atretic, which means they die, and she ovulates one. There is no way to increase AMH or to increase ovarian reserve. The benefit of acupuncture and or acupuncture and herbal medicine is to improve egg quality, lining quality, or sperm quality.
Of course. Understood. Thank you so much for again for the clarification. And that was our last question. So thank you so much, all of you, for joining us tonight, for all of your great questions indeed. And of course, Mike, for your expertise, for your assistance. I can only show you the comments right here. Thank you for all of your advice. Very informative, interesting info. And it was great, different, and useful. And there are more of those coming, as you
That's
can see.
wonderful. May I just say a quick word?
Yes, go ahead, of
So
course.
I just want to thank all of the participants again. You guys have just generated the most intelligent and interesting and important questions. And I feel blessed to have been here to be able to take your questions and to hopefully shed some light and give you some information on acupuncture and herbs, and also a little bit of Western reproductive medicine as well. I want to wish you all Godspeed in your journey to family. I know this is a very, very difficult thing that everybody's going through. Keep your chin up, stay strong. It's a journey, and you will get there. Of that, I'm certain. Just don't give up. Sometimes you can get bloodied knees on the journey, but eventually you will succeed. Love, blessings, and best wishes to all of you, and thank you all again so much.
Thank you, Mike. That was really, really interesting. And thank you for answering the question. And you were very passionate about that. And I love that about you for sure. And as you can see, there are more of those as well. And I just want to mention, of course, remember it has been recorded. Therefore, you will have a chance to watch this again from the very beginning. So I can only encourage you to simply subscribe to our YouTube channel. That way you will know when the new video is uploaded. And well, you will find all of our events on myivfanswers.com. So you can visit there. There are plenty of interesting topics, as you know. So I can only encourage you to check them out. And once more, Mike, it has been a great pleasure to actually have been able to talk and discuss this particular topic. You've been brilliant. Thank you so much. Have a lovely day, the rest of the day. And also, I just want to mention that we will be back here at 8 p.m. UK time today with Andrea Trigo. So if you would like to get some other advice, then come and join us tonight as well. Mike, again, thank you so much. And I hope we will be able to simply do it again.
I also just want to say, Carolyn, thank you so much. I neglected to thank you. Thank you so much for making this happen. And you've done a wonderful job, and you've done a wonderful job working with me, getting this thing set up. And I so admire and respect what you've done. And thank you so much again.
Thank you. It's, as I mentioned, it's really, really easy when you have such a nice and helpful presenter. So it's a pleasure. Thank you so much
Thank
to you
you.
all. Have a lovely evening. Mike, have a lovely day, and well, in touch. Bye.
Bye bye, everybody. Thank you.